you can see this is the dura arachnoid matter, arachnoid and the pia matter. The dura matter endosteal layer has remained in the skull and the meningeal layer along with this. Now we have cut it with the help of this brain knife from the frontal pole to the occipital pole, and we have made two sections of the brain. Both are horizontal section, and in the horizontal section what we are going to see are, this is the fibers of the forceps minor, which are the fibers that are passing through the anterior limb part of the corpus callosum or the anterior part, and these are the splenial fibers that make the forceps major. And here we can see the anterior horn of the two lateral ventricles of each side, anterior horn of left ventricle, anterior horn of the right ventricle. Inside this area, it is the central part or body of the lateral ventricle. Now as you go backwards towards your occipital pole, here you can see the two posterior horns. These are the two posterior horns. They are again bridged across by this, we can see here, that is the forceps major fibers. And from your posterior horn, if you just go to see inside, then it is in the inferior, this is the part of the body. In the lower section, if you go from this side, then you are in your temporal lobe. So here lies your inferior horn of the, this is the inferior horn of the lateral ventricle. Here is the anterior horn, then your body, then this is inferior horn, these are the posterior horn. And these are the choroidal plexus of the blood vessel, choroid capillaries, etc. And this is stella choroidea, we can see the stella choroidea of the lateral ventricle. And in between the two, we have this partition, the septum pellucidum. Now we are going to see the internal capsule in relation with the basal ganglia. So what we see here, find this is the anterior limb, genu, and here lies your posterior limb of the internal capsule, and then it again goes backwards. So this part, it is the retrolentiform part of the internal capsule, you can see here, and as you go towards the occipital pole, you get the sublentiform part. Sublentiform part actually goes below. So this is entire course of the internal capsule that serves as the relay station for all our ascending and the descending tracts to the cerebral cortex to and fro. Peeping into the anterior horn of the lateral ventricle is your head of the caudate nucleus, and as you proceed towards your anterior limb, then the genu, from the genu region, this area, you can see this is your lentiform nucleus, and here is bulging of the thalamus. Now lentiform nucleus is again divisible into two zones. What are the two zones? So you have the medialmost part, which is known as the globus pallidus, and the lateralmost part, which we have, that is called as the putamen. And then we have a thin narrow strip of the tissue, white tissue, and then we get claustrum. So this area is the claustrum, we get here claustrum. So this is our internal. So you have the medialmost part, which is known as the globus pallidus, and the lateralmost part, which we have, that is called as the putamen. And then we have a thin narrow strip of the tissue, white tissue, and then we get claustrum. So this area is the claustrum, we get here claustrum. So this is our internal capsule, and in this region it is the insular cortex. So claustrum is actually intervening between your putamen and the insular cortex, and further outside you will be getting your external capsule. So here lies the cavity between the two thalamus. Cavity between two thalamus is known as the third ventricle. It is the third ventricle. Here is your third ventricle, right? And in your this posterior horn, you can see the deep elevation which has been made by the calcarine sulcus, that is calcar avis. On this side also you have the calcar avis, and if you cut section from your inferior horn, then you will be able to see the pes hippocampi, that is hippocampus due to the elevation, due to hippocampus. And this was again a medial section of the cerebral hemisphere from which the corpus callosum has been removed. After removal of corpus callosum, you can clearly see the thalamus area. You can see the part of this lateral ventricle area, and here you can also find the white fibers. These are the white fibers of the cortex. So we have done a superficial dissection of the superolateral surface of the cerebral hemisphere to show the different fasciculus. So in this region we get the small short U-shaped loops which are called as the arcuate fasciculus. And after scooping off a lot of amount of brain tissue, we have come to the level of the fronto-occipital fasciculus. These are different longitudinal fasciculus we have here, and the fibers of corner radiata, you can see some fibers has been kept. So these are the fibers which are descending down vertically. So the fibers, they are ascending tracks, descending tracks, and they are going to cerebral cortex. If converge below, then it makes crus cerebri. As you just remove layers of these fibers from this area, we can show the mass of the grey matter which is known as the putamen. This is the putamen. And here from this section again, correlate just like this. There was the internal capsule, there was the thalamus. So we have reached and demonstrated the level of this putamen from this side, that is from the other side, from the superolateral aspect of the cerebral hemisphere. So this is a part of the basal ganglia. So basal ganglia basically consists of your caudate nucleus, which has a head, body and tail. Then it has the lentiform nucleus, which is lens shaped, medial part being known as globus pallidus, lateral part being called putamen, and then further lateral claustrum tissue separates it from the cortex of the insula. So this is all. এই দিকটাতে খুব সুন্দর